Now, as far as you mentioned earlier that you've been here before, this is actually your third visit as you the program evolved. What would you then say has been your assessment of those patients who you saw before on your first visit or your second visit? Do you think that the message you were trying to get through to them has been effective?
Yes, we were surprised today. We were really surprised. I came 3 years ago here with my president, and then we just wanted to be sure that Rotarians who wanted to have this program in your place, that they could perform. And also one of the duties was we must be sure that the Ministry of Health was in the program, because when we are leaving today, we must be sure that there is continuity of this care. So we were asking our participants who were team members of the hospital, but also team members of the district centers of care, what have you done between we were coming and now we are leaving? And we have eyes like that. We were surprised what they have done. They have ameliorated their care. They have done a lot of attention to the patients. The only thing, of course, we have to improve for those who are not coming to the centers. We need them to come and have trust in those doctors who have won a lot of new knowledge. So there is a huge change. And to be honest, we were so surprised today. Even the Minister of Health, who is a lot of work, we know, she took the time to be with us. So that means, yes, there is an engagement of all partners like we have to be. Patients, the doctors, the nurses, the Ministry of Health, and Rotarians.
So would you then say that the teaching component of this program is just as important as the actual foot care program?
Yes, right. And even more, we have the teaching of the patients, the teaching of the healthcare providers, but we have also the reorganization of care, because we learned from the international side, if you improve your care, then you will have less amputations. And you can reduce it to 50% only by this. So we see the results, and they have improved. The doctors took time. A lot of time. Can you imagine we were 2 days together, 10 hours work?
It sounds as if it was interesting, though.
Absolutely.
I think you've impressed upon me the importance of foot care for diabetic patients. I would like to give you the opportunity to perhaps impress again upon our viewers the importance, and particularly diabetics looking at this program, the importance of taking care of their feet.
Yeah. Even more, dear listeners, I think it starts with preventing diabetes. If I'm in the Caribbean, I feel always really welcome and warm, but we have to change our way of living all over the world, and particularly also here. Our food, we have to reduce the calories, we have to do more exercise. So that's first point, we have to prevent diabetes. And for those who have diabetes, one important message, we are wanted to go through it. Please take care of the foot. It starts with inspection, because you will not always feel. For example, we saw a patient who had broken his foot some time ago, and without having the good care, he's suffering now for ulcers because his foot changed totally. Or you can have a nail, and you can put your foot on the nail and even not feel it, and it can have ulcers. If you have an ulcer, for those who are in this situation, please contact immediately your nurse and doctors. We say internationally, time is tissue. We don't want to have amputations anymore.
Kristen, thank you so much for dropping in and visiting us, and we hope you continued success with your program and with your work at the IDEA.
Thank you, Terry.
And that has been our upfront presentation for tonight. We thank you for joining us. We'll have our regional news presentation when we come back.